Welcome back, everybody. Today we will be talking about the wear and tear theory. What is this wear and tear theory? It's the purpose that the body ages due to the cumulative damage of everyday use. The cells and tissues and the organs are gradually going to lose their function, their ability to properly be used, right? So this scenario can be caused due from small injuries like your stress, something like the toxins in your life, or even just your everyday lifestyle. They accumulate and then you will start to decline. Aging is also viewed as a result of wearing out, similar to how a machine, right? Think about the machines you're using every day. They deteriorate, they start to burn up, we need to buy new ones. This is our body, except we can't buy new ones. Internal factors could also be causing this wear and tear theory, such as overuse of the mechanics of the body and causing the body materials to slowly break down.
Whoa, you don't look so good. What's going on?
My knees squeak when I walk, and my heart just feels tired, and my brain is... What was I saying again?
Yes, your joints are rusting. Your engines be running non-stop, and your wiring's a little frayed. Sounds like you've been around the block too many times.
This is the wear and tear theory of aging. Just like machines wear down after years of use, so does the human body. Cells and organs get damaged over time from stress, toxins, and daily use. Eventually, the body can't repair itself as well as it used to.
I'm just wearing out?
Pretty much. But with good maintenance like exercise, good food, rest, you can keep running for a little longer.
Think of it like the body is your only car. If you take care of it, it lasts longer. That's the wear and tear theory in action.
Wait, so I just need a tune-up?
Take care of your body. It's the only one you got.
As nurses, there are ways to intervene for wear and tear. There are things like range of motion, changing bed positionings for patients, and ambulating. Range of motion is where you help the patient do motions that they can do even laying down that will help stop the breakdown of bodily mechanics. Changing bed positioning every 2 hours can help prevent things like skin breakdown, pressure injuries, and this can be added to a patient's care plan. And ambulating with a patient allows for the joints to not break down over time.
Oof, my joints just ache. My back is so sore. I get so tired easily, and I'm like an old car that's just been running too long.
Sounds like you're experiencing the wear and tear theory. Let's see what type of help we can.
The wear and tear theory says the body ages like a machine. It slowly breaks down from repeated use. But nurses can help by suggesting interventions to reduce stress on the body.
Let's keep you moving. We're gonna try some gentle exercises here, like walking and stretching. Those can help you. But first, we're gonna do a range of motion to see if that helps you. All right? Can I have your arm? I'm gonna support under your elbow and then at your wrist. Let me know if you feel any type of pain. Okay? How does this feel?
It feels fine, but wow, I sound like a squeaky hinge.
But does it feel better?
Yeah, it does. I feel stronger already, actually.
Great. Let's keep doing this while you're here, okay?
Okay.
Regular physical activity helps maintain body mobility, prevent stiffness, and support overall health. Evidence of wear and tear theory can help prevent things from happening, such as bed sores, arthritis, or muscle atrophy. As our bodies age, we have reduced ability to repair injuries, such as thinner skin, decreased circulation, and slower healing. Repeated pressure on the skin can damage the skin faster than the body can heal. Osteoarthritis is a prime example of wear and tear theory. Joint usage over time, like the knees, hips, spine, gradually lose muscle cartilage. Gradually lose smooth cartilage. With immobility, illness, or aging, muscles aren't used as much. Therefore, this lack of use leads to gradual shrinkage, which is the atrophy we were talking about. An example would be older adults who are on bed rest may lose muscle mass rapidly due to the immobility. This is where our nursing intervention with range of motion comes into play.
Ugh, I'm still stiff and weak and sore. I feel like my body's just falling apart.
Don't worry. Let's talk about what's happening and how we can help.
When the body ages, wear and tear can show up in many different ways. Let's look at one evidence-based practice, muscle atrophy.
Ugh, my arms feel so weak. I can't lift much anymore.
That's called muscle atrophy, when muscles shrink from lack of use. We'll use some active range of motions exercises to help keep your muscles stronger.
Okay, thank you.
Evidence shows that immobility leads to muscle atrophy. Nursing interventions like ambulating with the patient and range of motion can help preserve the muscle mass and the function of the muscles.
As with all theories, there are some strengths and limitations. Some strengths of the wear and tear theory include that it is a simple and relatable explanation for the body's aging. It explains aging like how cars or tools would break down with heavy use. This theory also highlights prevention strategies for preventing wear and tear. They encourage healthy lifestyle choices such as rest and nutrition, and also stress reduction. However, with strengths come limitations. As I said, the theory explains aging in a very simplistic way, but aging is a complex, multifactorial process. And the wear and tear theory explains it in a too simplistic way sometimes and doesn't explain all the factors. It also ignores the body's built-in repair system, which a tool or piece of equipment doesn't have. The body has DNA repair, immune response, and cell regeneration. There's also a lot of variability from one person to the next. Some people use their bodies heavily and exercise regularly, such as athletes, and according to the wear and tear theory, they should be breaking down more quickly, but they can go on to live long lives. While other people who live more sedentary lifestyles and experience less stress on their muscles and joints deteriorate quickly.
I'm just breaking down like an old car. My joints squeak, my engine's tired, and I'm running out of fuel.
Yep, that's the wear and tear theory. Your body's like a machine that wears out over time.
I'm basically just a clunker car.
Yes, but it helps people relate to aging. It's easy to picture.
That's why it's often used. It makes aging understandable.
Action.
Wait, so I'm just like doomed to fall apart no matter what happens?
No, not quite. That's one of the limitations of this theory.
Like than just wearing out. The wear and tear theory doesn't explain all the factors involved.
Action.
So I'm like a machine, but now I get upgrades?
Exactly. And that's how you maintain yourself. But there's more to the story than just wearing out.
In summary, the wear and tear theory is simple, relatable, and prevention focused, but it's also limited because aging is complex. Bodies repair themselves, and people age differently.
Your body isn't just a machine, it's a living, adaptable system.